launched by me as when I was the convener of healthcare in 2006, almost 20 years back. And every year this event happens, and usually we used to have the function as a welcome, and this time valedictory, so I don't see too many people. So by the time I'm sure from morning people would have got bored with some of them. To thank all of them. So today basically this event has the theme itself is quite interesting. We are talking about earlier when we talked about healthcare, we always used to talk about number of hospitals and number of beds and number of doctors we have and number of nurses we have. It's always about capacity. Now no longer we talk about capacity. I think the entire thing is whether however big or small the hospital is, how are we able to provide the outcome. So the whole medicine has moved from capacity to outcome based. So everything in healthcare is now revolving around outcome, and for us to really display outcome or demonstrate outcome, then every decision should be data driven. So the data has taken the central part. So even today as a medical professional, be it a doctor or a paramedical professional, everyone has to have understanding of the data and analysis of data to present what their particular department is doing or particular division is doing. So it's all data driven decisions today. And when we move into data, initially of course we were using computers and IT technology to analyze data. Now everything has moved into AI. So today even healthcare, the hero of what's happening in everything in healthcare is AI. So a doctor of course is there, but he has to be using AI to plan the treatment and sometimes to even prevent and diagnose diseases early. So the AI has become one of the most important things. Any conference we give today, there is a separate area for AI, whether it is diagnosis or treatment planning, the pharmaceuticals or medical devices, all of them are now driven by AI is the central part of everything being done in healthcare. The second is also we are talking about precision. The precision is basically now people used to rely excessively on human skills. Now we are going to robotics. So today I think robotic surgeries are becoming central part of everything we do. All the complicated surgeries are being conducted by the robots in almost all divisions. And I think the robots, the AI, so we are in a world where the technology is taking the central part of everything being done in healthcare. So now Tamil Nadu, if you come back and say India itself is in a very unique position because we have a combination of everything. We have the maximum 1.4 billion people and so much of clinical data is available with us and so much of clinical talent is available with us, particularly doctors and paramedical staff being here. There is a huge database of people and database of and also the talent of doctors and paramedical are available with us. So for us to really use this, I think India is no longer going to talk about being a developing country and start doing what Western world is doing. Now this whole thing is about technology enabled, software enabled healthcare. I think India can take the forefront of delivering the best of healthcare and be a role model for the entire country. And within India, Tamil Nadu is in a very unique position. For over the past several decades, in everything in healthcare, Tamil Nadu has been a role model. Whether it is a private healthcare, public healthcare ecosystem or NGOs, you talk about all of this, Tamil Nadu has been in the forefront of delivering high quality healthcare. But today is a time where we can go far beyond it to think not just Tamil Nadu can be the best state in India, but we can actually be the front runner and become a global destination for healthcare when it comes to delivery of care, or when it comes to diagnosis, or when it comes to technology driven medical devices. All this, there is a lot of potential for Tamil Nadu to be the forerunner in healthcare. That's the reason today's the session, I'm sure you would have all attended the session the whole day, and I saw the agenda and done by Mr. Rajarajan very nicely, and all the sessions I'm sure would have been thought-provoking in some form or other. And we in FICCI always deliberate, and we use nowadays, we do at least 2 to 3 TANCARE events per year. one in Chennai and one or two outside Chennai in other cities also, to bring all the healthcare thought leaders under one roof and possibly deliberate and debate on what is going around us and take some of the findings to the government of Tamil Nadu or even the central government for probably taking right decisions. There is so much happening even both in central and state side. National Health Mission itself is a great initiative. So every state government is looking at really technology driven care now in right from primary health to quaternary health. I think technology driven care is taking the central part of everything being done. So I think we as a state, this is the time for us to take a leapfrog movement for healthcare, to really take it forward and start being a preferred destination for everything. If you look at healthcare, there are 4 pillars. The health education is extremely important. Tamil Nadu has some of the best medical institutions, the medical education institutions, right from CMC Vellore to private institute to Madras Medical College to Stanley Medical College. We have been in the forefront of medical education. So I think it's time for us to really use that the first mover advantage in education to actually upskill and become ready for the new age of healthcare. The new age of healthcare, we know, initially was opinion-based medicine, then moved to evidence-based medicine. Now we have moved to personalized medicine. In this arena of personalized medicine, every individual patient has to be considered as a unique person. So because what is common to one person may not be common to other person. So this is how these new areas are coming, like genomics, metabolomics and proteomics. All these kind of new age diagnosis is coming, molecular imaging is coming. So there is lot to be done, and Tamil Nadu, between the industry, academia and government, if we all work together, we can create the right ecosystem for positioning Tamil Nadu as a not just a leader in India, but in the entire Asian continent by doing lot of innovative activities. So some of the request to the government is also to enable, particularly to do, now so much technology is happening, so much devices is coming up. So we need to create this clinical trial ecosystem where we have access to the patient data, access to do clinical trials within government institutions, and we have been talking with several thought leaders in this area. How do we really ensure that the industry, particularly the startup ecosystem, is start accessing some of these ecosystem available in Tamil Nadu government, so that we can start leapfrogging and making a big impact in healthcare. So I'm sure if we all work together, between private, public, NGO, government, all of them coming together and working, we can really position Tamil Nadu as a global healthcare destination. I also, my sincere thanks once again to Mr. Arun Thamburaj for coming here and blessing this question. Thank you.
To us, basically advancing the public health system's digital transformation, which is very apt but also complex. When we look at Tamil Nadu is one of the, of course, is one of the leaders, pioneers in public healthcare. And when we go for any discussions across India or any forum, Tamil Nadu has done huge achievements in the field of health, and it has been because of the robust public and private healthcare systems in the state and the environment which is supporting that. When I look at the progress made by Tamil Nadu in various areas, to be more precise, the basic aspects in which the health system is being valued, basically maternal child health, Tamil Nadu is right now has the second lowest MMR in the country and second lowest IMR in the country. It's because of the collaboration between all the private and the public entities next to Kerala and Andhra, especially in case of MMR, next to Kerala only in the case of IMR. And we are also looking forward to improving the systems to ensure that we go to less than 30 as the MMR for Tamil Nadu and 5 for IMR. Not only that, with the advancements happening, I just thought I should just touch upon the basics in which Tamil Nadu is very strong in the fundamentals. But of course, the needs are changing and the problems are complex, and we need to take a shift on how health systems should be looked at, both from the private and the public perspective. And the need which we look right now here is about the engagement of government with private on certain key areas, where I think the participation of NGOs and social, the business community, business organizations, the groups are very, very important. As you all know, Tamil Nadu, with the development, we are also one of the most, the aging states in India, and by 2030 will be one of the aged states. So I think we need to prepare for a lot of other aspects which should keep coming because of the aging population. The other important thing is also about the rising NCDs and the need to prevent the complications. So how on mass scale across the spectrum, how to identify cases early and also bring in the aspects of control of the NCDs to ensure that they don't give rise to complications. One other important thing is cancer, which was also spoken by previous speakers, which requires huge investments, not only from the public side, but also the private. But the base of all this, we need to provide affordable healthcare. This is the basis on which we should definitely work. And there's a lot of scope for collaboration with the private parties. So to name a few, with the NCDs which you see rising, and chronic kidney disease is one of the major aspects because of complications which you see due to hypertension, diabetes and also other factors. We have a huge scope to engage with the private sector as far as setting up dialysis centers are concerned. Even Tamil Nadu has now floated a tender. I think it's already tenders bids have also been received for 50 dialysis care centers across Tamil Nadu in the public healthcare systems, in the PHCs level. The other aspect which we are actually trying to rope in private partners, especially diagnostic or also seated here, who can also participate, is on anomaly scans. We don't have I would say Tamil Nadu, in all medical colleges we do have radiologists, but the quantum, the number of cases that we get, the AN mothers, almost 8 lakh mothers get pregnant, and around, and for the 8 lakh cases, how are we going to do anomaly scan? So in that we actually wanted to have one anomaly scan center in every medical college, which can be run with a private engagement using insurance funds. So this is one thing which is under process. It's already tenders have been floated, and the scope is there for the private parties to engage as well in diagnostics. The other thing is also in cancer diagnostics, especially the PET scan. Already it's well established in Tamil Nadu. TNMSC is having around 7 centers where PET scan is there. Now again, another 4 are being added, and tenders have already been floated. I think it's also being finalized. But there's a huge scope, especially when I'm speaking to the MD of Genomics and the GSK, Mr. GSK, I was also telling him about the scope where government can engage with private entities on setting up high-end diagnostic hub, where we can provide space and also support, and also if we can bring certain high-end diagnostics under the amount of insurance, we can also have one high-end diagnostic hub at Chennai, where all the medical colleges, the private entities, everyone can also come and avail services, especially for cancer. So diagnostics, where most of our samples go across India for confirmation and for especially the genomic aspect. So I think we are also discussing about that, and there's a huge scope which Tamil Nadu also wishes to engage. And anybody has anything in mind which you can work with, you can definitely come. But of course, Tamil Nadu has its own plan which we are charting out, will be having soon in the next year. There's also a scheme by Government of India called the Viability Gap Funding Scheme, where around 80% of the funding will be done by the government and 20% by the private entities, which can also, there's also huge scope in that, where Tamil Nadu also looks forward for establishing cancer care centers. Tamil Nadu is one state, I should say, is already having 26 cath labs, around 13 LINAC across the state. We also have around more than around 10 cobalt treatment therapy given. I mean, we have such centers across the state. So name anything, public health system has most of the high-end treatment aspects which are there. But of course, there are certain pockets which would also require some collaboration with private entities. where you can also set up institutions, maybe in the model of Assam, or even in Tirupati there are institutions that are set up by various institutions. There's a huge scope where you can try to intervene and also engage with the government and try to come up with some innovative ideas for taking things forward. Tamil Nadu is one state also where we have taken up digital health very seriously. Of late, our Chief Minister and our Health Minister, Secretary, everybody is stressing on a unique health ID, which is also being promoted by the Government of India, where we are also looking forward to, already HMIS has been 3.0, we already had a couple of versions. Now HMIS 3.0 is being implemented across all the public health institutions, and tomorrow the engaging with the private entities who also have these electronic health records being taken up in your entities will be a great help for the patient to access data both in government and private at any point in time. So state is investing huge in that, and CDAC is actually engaging with us. Almost 8 districts have now gone, the primary healthcare systems are now into HMIS. We are also trying to bring in the secondary and tertiary institutions to HMIS. Around 5 medical colleges will come by the end of this December, another 5 by the end of January 2026, and by May 2026, Tamil Nadu is aspiring to be the first state to map all the institutions under HMIS with data patient as soon as they enter the registration up till admission discharge is all electronically captured, and the data will be available for the patient to access at any point in time, even if they go to a private facility. Even if they go there using their ID, this interoperability also is being facilitated by the unique ID. So that facilitation also is being offered, and this can also be one game changer. However, we were initially skeptical as to how HMIS would work, but I should say, after this Nalankakum Stalin, it is one of the flagship schemes of our government, where multi-speciality camps, the super specialty doctors are coming to the village areas, and all the data in a village is being captured online using HMIS. That was the decision that was the event which gave us the confidence to push HMIS across, and today we are seeing 10 districts under HMIS. Next month we are giving another 8 districts, next month another 8 districts, so 16 districts by Jan end would be under HMIS completely. So this, in Nalankakum side, if you see, there's one of the camps across India we can boast. The Tamil Nadu state government has captured the data end to end using the computers, and there has been no manual interface, including the lab reports are being generated within a span of 2 hours, and the SMS goes to the individual who was registered in the camp. So there is no need for them to run from pillar to post for the result. So such kind of efficiency comes in, which always brings in happiness to the poor people who come towards the public healthcare system. And integration of HMIS with already existing portals of government, like PICNI for maternal child health, and NCD portal, MTM portal, Makkalaitiri Marthum portal, all these things are also being taken up. And as you all know, Tamil Nadu is one state which has also launched the Makkalaitiri Marthum for NCD, and Tamil Nadu also wants to stress more importance on NCD. And we are also trying to take NCD the way forward by giving emphasis on door-to-door screening for complications also in Tamil Nadu, especially retinopathy and the nephropathy, for which we are trying to come up with, already we have given the sticks, urine sticks which they use to categorize, but I'm using the GFR and the creatinine value arriving at its point of contact machines are also being made available. At the same time, we are also looking at, Tamil Nadu is one state which has launched its own Tamil Nadu Cancer Care Mission, which has its own objectives. One of the most important things in this mission is the launch of the HPV vaccination. You would have heard that Honorable Minister has announced that it will be launched across Tamil Nadu in the coming month, in January 2026. So we are going to scale it up across the state. Initially 4 districts will be taken up, and then we are going to expand it across the state and give vaccines to all the girl children at the age of 14.
Joint Managing Director GEM Hospital plus Convener Healthcare Panel of Tamil Nadu. இன்னைக்கு இங்கே டேன்கேர் அப்படின்ற இந்த ஈவெண்ட் இங்கே தாஜ் கனிமரா ஹோட்டலில் இன்றைக்கி நடந்துச்சு. இது ஈவெண்ட் எதுக்கு அப்படின்னா இன்றைக்கி ஹெல்த் கேர்ன்றது எவ்ரிடே மாறிக்கிட்டே இருக்குது. புது புது டெக்னாலஜி வந்துட்டுருக்கு, புது புது சயின்ஸ் வந்துட்டுருக்கு. அஃப்கோர்ஸ் இன்றைக்கி இந்த பஸ்வேர்ட் ஏஐ இன்னைக்கு பெரிய லெவலில் வந்துட்டுருக்கு. இன் டயக்னாஸ்டிக்ஸ் ட்ரீட்மெண்ட் அளவில் இன்னும் பெரிய லெவலில் வரல, பட் டயக்னாஸ்டிக்ஸில் பெரிய அளவில் வந்துட்டுருக்கு. இப்படி இந்த மாதிரி பல எமர்ஜிங் டெக்னாலஜிஸ் அண்ட் இஷ்யூஸ் வந்துட்டு இருக்கிறப்ப எப்படி ஹாஸ்பிட்டல்ஸ் எல்லாம் ஒவ்வொருத்தர்கிட்ட இருந்து நம்ம எப்படி லேர்ன் பண்ணிக்க முடியும், ஒவ்வொருத்தரை எப்படி சப்போர்ட் பண்ண முடியும், அந்த வகையில் தமிழ்நாடுவை எப்படி ஆல்ரெடி நம்ம இந்தியாவில் ஒரு ஹெல்த் கேர் லீடர்னு சொல்லிக்கலாம் தமிழ்நாடு. பட் இன்னமும் அடுத்த கட்டத்துக்கு கொண்டு போகிறதுக்கு எல்லா ஹாஸ்பிட்டலும் ஒன்று சேர்ந்தால் தான் முடியும். அவங்க தனியாக உட்காந்து பண்ணிட்டு இருந்தால் முடியாதுன்ற இந்த நோக்கத்தோடு தான் ஃபிக்கி ஹெல்த் கேர் பேனல் இதை வருஷம் டான் கேர் அப்படின்ற பேரில் சென்னையில் மற்றும் மத சிட்டியில் நடந்துகிட்டு இருக்கோம். இந்த வருஷம் இது செகண்ட் டான் கேர். கோயம்புத்தூரில் இந்த வருஷம் நடந்துச்சு ஜூனில், இன்றைக்கி டிசம்பரில் இங்கே சென்னையில் நடத்தியிருக்கோம். இது சென்னையில் இருக்கக்கூடிய எல்லா மேஜர் ஹாஸ்பிட்டல்ஸ்லேருந்தும் அவங்க அட்மினிஸ்ட்ரேட்டர்ஸ், டாக்டர்ஸ் இன்றைக்கி பார்ட்டிசிபேட் பண்ணாங்க. நிறைய ப்ரோக்ராம்ஸ் பேஸ்ட் ஆன் ஸ்டாஃப் மேனேஜ்மெண்ட் டெக்னாலஜிலாம் இன்றைக்கி நடந்துச்சு. ஸோ அந்த ப்ரோக்ராம் பற்றி மிஸ்டர் ராஜராஜன் சொல்லுவார். ஸோ இந்த ஃபிக்கியோட டான் கேர் அப்படின்றது ஹாஸ்பிட்டல்ஸை ஒருங்கிணைத்து ஹெல்த் கேர் எப்படி அடுத்த லெவலுக்கு எடுத்துகிட்டு போகணும், தமிழ்நாடு எப்படி கொண்டு போய் குளோபல் மேப்பில் வைக்கணுன்றதுக்காக நடத்தக்கூடிய ஈவெண்ட். இன்றைக்கி ஈவெண்ட்டை பற்றி மிஸ்டர் ராஜராஜன் கன்வீனர் ஹெல்த் கேர் பேனல் அவர் உங்களுக்கு எக்ஸ்பிளைன் பண்ணுவார்.
வணக்கம். இன்றைக்கி முதல்ல காத்தால நாங்கள் ஆரம்பித்த செஷன் எப்படி தமிழ்நாடு ஹெல்த் கேர் மருத்துவத்துறையை ஒரு தரம் வாய்ந்த துறையாக நிறுத்துறதுன்னு பொறுத்து அதில் வி ஹேட் ஸ்பீக்கர்ஸ். அவங்க டாக்டர்ஸாக இருந்தாங்க, மேனேஜ்மெண்ட் பீப்புளாக இருந்தாங்க. அவங்கெல்லாம் எப்படி நம்ம அவுட்கம்ஸ் நம்ம ஃபோக்கஸ் பண்ணணும், நம்ம எப்படி பிராண்ட் பண்ணணும், நம்ம எப்படி பொசிஷன் பண்ணணும்னு அந்த ஃபஸ்ட் பேனலில் டிஸ்கஸ் பண்ணோம். ரெண்டாவது பேனலில் வெங்கட் ஃபணிதர் சார் வந்திருந்தார். அவர் அதாவது ஒரு தலை சிறந்த ஒரு மருத்துவத்துறைக்கு எப்படி கம்யூனிகேஷன், கோஆர்டினேஷன் அண்ட் கல்ச்சர் அந்த மூணும் முக்கியன்றதை பற்றி அவர் பேசினார். அடுத்ததாக நம்ம இந்த குளோபல் ஹெல்த் கேர் லீடர்ஷிப், அதாவது தமிழகத்தோட நிறைய புள்ளி விவரங்கள் பார்த்திங்கன்னா இந்தியா பொறுத்த வரைக்கும் அதை விட பெட்டராக தான் இருக்குது. நிறைய யூரோப்பியன் கண்ட்ரீஸ்க்கு நிகராக இருக்குது, சில இதில் அதிகமாகவும் இருக்குது. ஸோ அதை பற்றின ஒரு செஷனாக இருந்தது. அந்த செஷனில் என்னென்னலாம் பண்ணணும், டேட்டா தான் புதிய ஆயில்னு சொல்லுவாங்க. இப்போது அந்த டேட்டா வச்சு எப்படி நம்ம எவிடன்ஸ், எப்படி எக்ஸ்பீரியன்ஸ் க்ரியேட் பண்ணுறது, எப்படி நம்ம மேலும் மேலும் முன்னேறது, அதை பற்றின ஒரு பேனல் டிஸ்கஷனாக இருந்தது. அதுக்கு அடுத்ததாக we had a discussion post lunch on எப்படி நம்மளோட ஹியூமன் ரிசோர்ஸஸை மேம்படுத்துறது, அந்த அப்ஸ்கில்லிங். இப்போ ஸ்கில் டெவலப்மெண்ட் கவுன்சில்லாம் இருக்குது, நம்ம தமிழ்நாடு ஸ்கில் டெவலப்மெண்ட்டில் வந்திருந்தாங்க. ஸோ அந்த ஸ்கில் டெவலப்மெண்ட் கவுன்சில் அந்த இதை பற்றி பேசணும், எப்படி நம்ம தரத்தை கூட்டுறது பேஸ்ட் ஆன் நம்மளோட ஹியூமன் ரிசோர்ஸஸை வச்சுக்கிட்டு. அதுக்கு அடுத்ததாக we had a session on preventive health care. அதில் டாக்டர் அருண் கண்ணன் ஆர்த்தோபெடிக்ஸ் டாக்டர் ஃப்ரம் அப்போலோ ஹாஸ்பிட்டல்ஸ் அதை பற்றி தரமாக பேசினார். அதுக்கு அடுத்ததாக கடைசி செஷனாக சூஸிங் ரைட் டெக்னாலஜிஸ் அமிட் த டெக்டானிக் ஷிஃப்ட். அதாவது இப்போது சார் சொன்ன மாதிரி இந்த ஏஐ, எம்எல் பல தரப்பட்ட அட்வான்ஸ்மெண்ட்ஸ் வந்துட்டுருக்கு. இந்த டெக்டானிக் ஷிஃப்ட்னா நம்ம இந்த பூமி பிளேட் மூவ் ஆகிறதுனால எர்த்குவேக்லாம் வருதுல்ல, அது மாதிரி ஒரு பிரளயமே வரா மாதிரி இப்போ ஹெல்த் கேரில் நிறைய மாறுதல்கள், நல்ல மாறுதல்கள் வந்துட்டுருக்கு டெக்னாலஜி மூலமாக. ஸோ எந்த மாதிரி டெக்னாலஜி நீங்கள்லாம் ஹாஸ்பிட்டலில் எடுத்து செய்யலாம், அதனால் மக்களுக்கு என்ன பயன், அதை எப்படி இன்னும் மேம்படுத்துறது, இன்னும் என்னென்ன கேப்ஸ்லாம் இருக்குது, எப்படி அதை மேன்மேலும் மேம்படுத்தலாம்னு சொல்லிட்டு அந்த பேனலில் டிஸ்கஸ் பண்ணோம். கடைசியாக we had the valedictory function. நீங்கள்
வேலிட்ரி ஃபங்க்ஷன் திரு ஜிஎஸ்கே வேலு அவர்கள் ஃபிக்கியோட தமிழ்நாடோட சேர், அவர் இன்னைக்கு கெஸ்ட் ஆஃப் ஆனராக பார்ட்டிசிபேட் பண்ணியிருந்தார். மிஸ்டர் அருண் தம்புராஜ், மிஷன் டைரக்டர் ஆஃப் நேஷனல் ஹெல்த் மிஷன், அவர் சீஃப் கெஸ்ட்டாக வந்திருந்தார். அப்போ அவர் எப்படி பப்ளிக் ப்ரைவேட் பார்ட்னர்ஷிப் மூலமாக ஹெல்த் கேர் இன்னும் அடுத்த லெவல் எடுத்துகிட்டு போக முடியும். ஏன்னா தமிழ்நாடு மட்டும்தான் கம்யூனிட்டி பப்ளிக் ஹெல்த் கேரும் சரி, ப்ரைவேட் ஹெல்த் கேருமே ரொம்ப மேம்பட்ட அளவில் இருக்குது. இதை சேர்ந்து எப்படி பார்ட்னர்ஷிப்பில் பண்ண முடியும்னு சொல்லியிருந்தார். அதனால் ஐ திங்க் இந்த ஈவெண்ட் இன்னும் இது மாதிரி நிறையா நடத்துறதுக்கு ஒரு ஃபவுண்டேஷனாக அமையும் நம்புகிறோம். இன்னும் இந்த மாதிரி நிறையா ஈவெண்ட்டும் ஃபிக்கி தமிழ்நாடு மூலமாக இதை நடத்தும். தேங்க்யூ.